My name is John Kelly. I'm a personal injury attorney who focuses on birth injuries across the nation. And I'm going to continue my series on birth injuries with this number 5 video, birth trauma and physical injuries. Medical care and healing for fractures and minor injuries. Treatment tends to be straightforward and focused on comfort and natural healing. For a clavicle fracture, as mentioned, immobilization of the arm for 7 to 10 days is typical. You might be advised to handle your babies by scooping them under the buttocks and supporting the head instead of lifting under the arms for that initial period to avoid any kind of pain they feel. Pain management for a newborn might just be gentle handling. Sometimes a doctor might suggest a small dose of infant acetaminophen if the baby seems very uncomfortable, but often it's not needed as infants tend to cry only when the area is moved or otherwise can be soothed. By the 2-week mark, most babies are moving their arm freely without pain. For skull fractures or head trauma, the NICU team or pediatricians will manage monitoring. They usually check neurological status, perhaps repeating an ultrasound of the head, and to ensure no other bleeding. They will also watch for signs of jaundice if there was bruising, like in the instances where there is a hemorrhage. You as a parent mostly will be in wait and see mode when the medical team ensures the baby is stable. If your baby had more severe head injury and you're in the NICU, it can be a stressful time with monitors and possible seizures to manage. Once past the immediate risk, the babies often do fine, but some may later need developmental follow-up similar to HIE babies if there was loss of oxygen or brain involvement. It's wise to enroll in early intervention program just to have professional track development milestones for any baby that had significant head trauma or major resuscitation at birth. For cephalohematoma, no active treatment is needed. Just be aware of the bump and handle the baby's head gently. No aggressive rubbing on that spot. It's okay to lightly touch it. You won't pop it. If you touch it, it might feel hard and then gradually shrink. Keep up with pediatric checkups where they'll examine it. If by some chance it calcifies heavily in toddlerhood, some parents consider minor surgery to soothe the residual bump from cosmetic reasons, but this is rarely necessary. For facial nerve palsy, the pediatrician might refer you to an eye doctor to help manage eye care if the eye doesn't close fully. Otherwise, it's observational. You will likely see improvement within the first 1 to 3 weeks and usually full recovery by 3 to 4 months at latest. Doing things like massaging the face or other folk remedies is not generally needed. Nerve fibers just need time. Ensuring the baby can nurse or feed is more important sometimes if one side of the mouth is weak. Feeding can be a bit tricky. If you have further questions about this, please feel free to reach out to me at Kelly Law Team. My name is John Kelly, and you can reach me at 602-283-4122.